Hey, this is Andrew at PhysioWorks. It is Friday, it is the end of the week, and hopefully you are also ready to have this weekend. And hopefully you've had a good week like me, and you've got a fun weekend coming up. This weekend I'll be involved in organising the Girls on the Run 5K at UAH, and so hopefully you're going to see a good number of people out and enjoying the 5K. If you're not familiar with Girls on the Run, it's a 10-week education program focused around running, and the goal is to encourage girls to have more confidence in themselves and learn life skills that they can use to become more successful individuals as they move through adolescence and adulthood. It's a really neat program, and we've had a chapter here in Huntsville that's been gradually set up over the last 3 years, and it's been a very full-on year, and this is the culmination of it. And I'm on the board of directors of Girls on the Run of North Alabama, and we're looking forward to continuing to bring that with us to the coming year. So let me get rid of my silly mask and hat and glasses. And what I want to talk today about is hamstring injuries, different type of hamstring injuries. And we've got the skeleton behind us, and I'm going to kind of kneel down at his feet and move him around a little bit. So we're probably going to tuck his arm up here in his pelvis so that it stays out of the way. Anywho, right, I'm going to try and move the tablet around a little bit. Hamstrings. So in this skeleton model, we can see the hamstring kind of approximated, running from the sit bone, the ischium here, down the back of the leg, below the knee. And basically there are two problems we typically see in the hamstring. We see tendon problems, tendinopathies. Used to call them tendinitis, but we really call them tendinopathies now to signify that they're not primarily an inflammatory problem. And we can see tendinopathies up here, proximally, where it joins at the sit bone. And we can also see it down here, distally, at the where it attaches below the knee. And get your toes out of the way, Mr. Skeleton. Anyhow, so we tend to see a lot more proximal tendinopathies. And then the other thing we can see is actual injuries of the muscle itself. And here, illustrating the muscle with the faithful TheraBand, maybe is one of the best uses for it, because I don't use it tons in the clinic for exercises. Anyhow, basically hamstring injuries tend to occur when we see rapid acceleration or rapid changes in direction, or where there are high amounts of hip flexion. And the majority of work probably has focused on hamstring muscle injuries versus tendon injuries or tendon pain. And the good thing about it is that we can use some of the information from that and apply it to tendon problems. So just a quick kind of a little anatomy lesson here. When we contract the hamstring, so when we contract it, it causes the knee to bend. Okay, so tightening the muscle and shortening it causes the hamstring to bend. Now, if instead we bring the hip up into flexion here, so hip is flexed, and just to help you get perspective, there's Mr. Skeleton. He really should be looking forward, but he's a bit disjointed. But his hip is flexed, and you can see that the hamstring tendon, the proximal hamstring tendon, gets pulled tight under the bone. Well, what then happens is if we then start to extend the knee out further, we get even more tension under the bone. So imagine a hurdler. So they're coming to hurdle and they're kicking their leg out. Every stride they kick out, there's potential for compression here under the bone. But also imagine you're sitting in your office chair. There's also going to be potential for compression, particularly if you're sitting in an unsupported chair that is very firm. And so typically with proximal hamstring injuries, there's a degree of compression. Usually tendinopathies are due to an overload of the tendon, and that could be too much load in several different ways. It could be too much tensile load, the actual stretching load, and that can just be purely too much force, too much velocity, more than the person is currently capable of. But it can also be like here, where there's compression going on, too much compression, or it could be a combination of both. And there are other sites where we see compressive tendinopathies going on. So example really close by is here at the trochanter on the outside of the hip, and we see glute tendinopathy. So I haven't got a glute muscle here, but glutes running from the outside of the butt to here. And if the leg goes across the body into adduction, the glute tendon gets pulled tight. Let me reach around here. The glute tendon gets pulled round tight onto this trochanter bone and compressed. Another example, stick his foot up here, is the Achilles. So our Achilles tendon running up here into the calf and above the knee. We've got mid-substance Achilles tendinopathy, which is not compressive. Basically here, there's nothing it can compress against. But then we have insertional Achilles tendinopathy, where the tendon attaches here just around the bottom and underneath of the bone, so that when someone goes into dorsiflexion, they're under a lot of stretch, but the tendon gets pulled into compression under the bone. So that's another form of compressive tendinopathy. But here in what we're looking at, hamstrings, here's our point of compression for a proximal hamstring tendinopathy. So sitting, high amounts of hip flexion, show again on the skeleton, so hip flexion, high amounts of hip flexion, that loads that tendon up under the bone. I realise this isn't completely easy to see on the video, but anyone I see with pain kind of in the crease of the buttock who's got a hamstring tendinopathy is going to have pain with sitting for extended periods of time because of the firm surface compressing the tendon up against the bone. They're often going to have problems bending over. So I do CrossFit and I work with a number of CrossFit athletes, and when they go into a deadlift, their back is staying straight and they're flexing forward at their hips, and their tendon is getting pulled into compression against the bone. So when we start working with someone with a proximal hamstring tendinopathy that's compressive, as with other tendinopathies, we want to load the tendon in a very controlled way. So typically we're doing a heavier load and we're doing slow repetitions. And actually in the early stages for pain relief, we're even doing isometric exercise where the muscle is contracting but the joint isn't moving, but again, fairly firmly. And when we first of all do a heavy load exercise for a tendon that's compressive, we often want to work it in a non-compressive position. We don't want to work it in a compressive position because we already know that compression has aggravated it. Now, it all depends as well how far along the continuum of tendinopathy that a person is. If someone's very early in it, you could probably work them in compression to some degree. But if someone has got a really sensitive chronic tendinopathy, they probably will need to be worked outside of compression at first. And currently I've got a bunch of patients with lateral hip pain, so gluteal tendinopathy, and with proximal hamstring tendinopathy, and some of those have had pain for 5 years or more, and they've tried all sorts of different treatments. And to help them get over it, working outside of compression is one of the most important things to start with, and has helped them to get results when they haven't had them previously. So with a hamstring injury, the difference is that you're going to also feel it a lot more when you actually contract the hamstring. So if I contract the hamstring here and it helps the hamstring, the knee bend, you're probably going to feel some degree of pain when you've actually had a hamstring muscle injury. But again, we want to treat it with relatively heavy loads. But again, we also don't want to treat it with a lot of velocity at first. So in both cases, and this again leans more towards the research that we've seen in hamstring muscle injuries, we can potentially use an exercise called a Nordic hamstring curl. And this exercise has been around for a while, but a lot of the research for it has been done in the Nordic countries. And what's great about it is it gives you heavy load on the hamstring, and it places you in a non-compressive position. So what I'm going to do, I'm going to try and move the iPad around so you can see me do this this exercise, and we'll see how it goes. You can chime in with any questions that you might have. All right, so I'm going to move your back a bit. Apologies for that. Let's see. That should work. All right. Okay, so if I kneel here, I've got my legs hooked under the leg curl machine, and I have my hands out like this. I can lean forward and I can engage my hamstrings to control my descent. So I'm going to do that, and I'm going to, when I feel a sense of cramp, I'm just going to let my hamstrings go, and I'm going to catch myself on the ground. So I'm going forward, 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 forward. I felt my hamstrings cramp, and I let go, and I caught myself. So I'm engaging, keeping my core relatively engaged, leaning forward, leaning forward, leaning forward, and I'm catching myself. Now, that is quite a challenging exercise, actually, and I know I've been working on it, and it's been an exercise that's helped me with my past hamstring injuries that I've had. But as you get better at it, you can do the Nordic hamstring curl, where you lean forward, and then you actually stop yourself, and then you can reverse yourself, pulling back up with the hamstrings. Now, from an injury prevention standpoint, maybe the eccentric portion, where you're falling down and controlling it down, is the more important component, but I think in both cases it can be it's very, very helpful. Now, to kind of tell you why I want to mention this exercise is, not only is it good, I think, in people with proximal hamstring tendon pain, but also people with muscle injury, hamstring muscle injury, but the statistics are absolutely staggering. So I'm going to look down here to remind myself, but it is pretty staggering. So Nordic hamstring curls reduce hamstring re-injury by up to 87%, okay? And they also reduce new hamstring injuries by 70%. So it tells us two things. One is, it should be part of most people's programs for recovering from a hamstring problem. And they can actually, although they feel quite aggressive and advanced, they can actually be used very early on in someone's rehab. But it also tells us that these should be used as part of an injury prevention program in sports that have lots of rapid accelerations and lots of sprinting. So a lot of the research has been done in soccer. So soccer, you know, you're jogging around a little bit, you see the ball you're running for yourself, or you see another player that you're going to try and tackle, and you accelerate up. And then you get the ball, you then accelerate, you brake, you accelerate, you brake. This, as an exercise, is incredibly useful to reduce your injury risk in terms of hamstring injuries. And there are other exercises for different muscle groups that we sort of think of in similar ways, and we will probably cover some of them at another stage. But I will mention this time, there are programs that have been developed for certain sports that are very good at helping to reduce injury risk, or just outside of just one exercise. So within soccer or football, if you're from where I'm from, the FIFA 11 program. It's a dynamic warm-up program. It takes about 15 minutes to do, I think, and it runs you through a series of exercises to sufficiently warm up the muscles so that you don't get injured playing soccer. And there's really good research that's gone on behind that, and it continues to go on. But the Nordics are a great option as well. So I think the only other thing I can suggest, I'll show you one other version of the Nordic, and then I'll probably close up for some questions. But the Nordic is quite a challenging exercise. So what do you do if you really don't feel confident doing it the first time? What you can do is you can use an exercise ball. So if I get back in the same position to do my curl, and I have the ball out in front, I can do my Nordic curl and come back. Like that. So I can use the ball to help me to make that much more comfortable, because seriously, not everyone is comfortable doing it. And it's not just necessary from the hamstrings either. I've had patients who've had other issues, shoulder issues, neck issues, and they don't want to land on their hands as they're starting to learn to do it. So that's a really good option. So hamstring problems, proximal tendinopathy, muscle tears, strains, can be very effectively treated using a Nordic hamstring curl. Now, it's not the only thing you're going to use. You're going to look at overall body mechanics. Are there other components that are causing an overload? But in terms of providing enough load through the hamstrings, initially in a non-compressive position, the Nordic curl is an excellent exercise. And then as you gain strength, you can move into exercises that are more compressive. So for example, a deadlift is a great exercise. We do a lot of them in CrossFit. We saw a lot of hamstring problems from people who've been doing deadlifts in CrossFit because they've not got enough strength, they're not using the correct form, and they're doing that with a lot of velocity. And that's one reason I actually like my CrossFit box. I give a plug to them at CrossFit Nomad, because the teaching, the instruction, the supervision is very, very important. So eventually you get through Nordics, you get stronger. Prone leg curls are another great example of a non-compressive hamstring loading exercise. But then at some point you do have to start loading yourself. And when someone's having pain sitting in a chair and they've had that going on for a while, it can be very dispiriting. And it's great when you start to do something counterintuitive like loading the injured area and then start to see pain relief. And I see this quite a lot. I see patients who've tried all sorts of other things, but the one thing that they haven't tried is to sufficiently load the tendon. And when you do, you start to see great results in many, many cases. And so I know if I look back through my reviews, if I look back at different discussions and emails I've had with people, they really don't want to load that tendon at first. And you've really got to convince them that it's worth trying it. But when they load that tendon, not only do they get better, but usually they also reduce their injury risk. So the Nordic is a great exercise, and it can be used in both types of hamstring problems. It can be used for other things as well. And it's not just good for recovering from injury, but also good for preventing injury. Now, anyone out there looking, got any questions? I'd love to hear what you've got. I'll stand here for a few minutes, and actually I will mention this. So one of the other compressive tendinopathies that I mentioned was a gluteal tendinopathy, and so basically when your leg falls across the midline, the glute tendon gets compressed onto the bone, and what we're seeing is that reducing compression is very important there, like it is here in hamstring tendinopathy. So education is very important as well as exercise, and a study that was released in the last week looking at education, exercise and steroid injections for the lateral hip for gluteal tendinopathy, they found that the combination of exercise and education actually had a better outcome than a steroid injection in that gluteal tendon area. So very, very powerful to reduce compression for a period of time, especially when it's been going on for a long time, but equally very important to load the area. Now, my wife asks, does the skeleton have a name? I don't know, because it's not my skeleton. It's the owners of the building that I lease. I borrowed Farou's skeleton, so we'll call it the Farou skeleton. I guess that's what we'll call it. Or I guess you could call it Bob. It's a reference to Blackadder. Any other questions? We're talking hamstrings, we're talking tendinopathy, we're talking education and exercise. Anyone out there got any questions? Now, if you haven't got, if you're not online right now watching, unfortunately I couldn't do this the time I was planning to, which would have been closer to noon, around lunchtime. You can leave comments after the video is finished. You can send me a message via Facebook. You can call me on 256-529-7395, and you can also email me, andrew.walker@physioworkshsv.com. All of that stuff is in our Facebook page, and you can leave a message. You can start that conversation. Like I was saying earlier, I have patients who've had these problems for years. Just today, a lady updated her review about some hip problems she'd been having, and 5 years worth of hip pain. She'd tried different things, and it wasn't better, and no one could really tell her what to do. And the treatment I offered is very, very basic. So a lot of it is listening, first of all, to really try and understand what the problem is, and then trying to do as few things as possible so that we don't complicate things. Because if you're doing tons of different treatments, you never know what is helping you. So I tend to use a very exercise-based approach, sometimes some manual therapy, but I don't really use ultrasound particularly. I don't use electric stimulation particularly, because most of those are really given more of a placebo effect, which is okay. There's nothing wrong with that. But for my patients, I feel that it's not giving them high value for what they're paying. So if you have any other questions, I'm going to sign off now. You can ask them in the comments after the fact. You can send a Facebook message. You can call me on 256-529-7395, or you can email me, andrew.walker@physioworkshsv.com. Alrighty, well, enjoy your weekend, and if you're at Girls on the Run's 5K tomorrow, hopefully we don't get washed away. Hopefully it doesn't thunder or lightning, and I will look forward to seeing you there. Alrighty, take care and have a good weekend.